recent advances in genomic technologies have driven providers of pre-implantation genetic testing services into really one or two testing platforms for both next generation sequencing and SNP microarray. And so that unification or commonality in the testing platform has driven a certain degree of standardization between the laboratories, at least in terms of the workflow and the technology applied. But what is not standard yet at this point in time is really both the input and the outflow from those technologies. So on the input side, it's sample handling and processing, bringing those samples into the workflow in the amplification stages and labeling. And then on the outflow side, the result interpretation, and this is probably the more important area. There is still a significant amount of manipulation and interpretation that must occur for each and every sample. And so the laboratory still exerts a tremendous amount of influence on the results for each sample that a clinic may be providing them. So as a healthcare provider, I think we owe it to our patients to ensure that the laboratories that we're choosing to do this testing have the necessary experience and expertise in human genetics and with these specific technologies to ensure that they are taking a sufficient amount of time to ensure that they're providing the best result and interpretation for every sample, for every patient. And this is the thing that I really appreciate about the approach that CombiMatrix is taking, this high-tech, high-touch approach. I know that they have 2 board-certified medical geneticists with years of experience reviewing and providing that interpretation for every sample. They're working with a team of well-experienced genetic counselors and genetic technologists in the laboratory. And so I know that I have this pool of experience to draw on for my patient's care. And in fact, that's exactly how we treat CombiMatrix at the Center for Advanced Reproductive Medicine in Kansas City. We feel that they're an extension of our practice, and we're partners in the care that we're providing to our patients. And so we have built a relationship of trust and understanding with them, and we know that we can pick up the phone at any time and have a discussion, not just about a given patient, but about a given sample. And so the thing that I would encourage everyone to do is ask themselves, who's handling and influencing my patient's samples and results? And how well do I know them or trust them?